Today, we are going to be working with Marissa, a 27-year-old female who suffered a spinal cord injury at the C7-C8 level. She has been in inpatient rehab for nearly 3 weeks, and during this intervention today, we will work on transferring, kitchen mobility and kitchen adaptive equipment, therapeutic exercise, and positioning. Her fiance is present for the session and will be helping out throughout the session. While working with Marissa, it is important to know her functional capabilities and possible deficits she may experience due to her injury. As a C7-C8 spinal cord injury, she will be able to extend her elbows. She will not be able to use her fingers. She'll be able to flex and extend her wrists, and she will have full rotation of her neck. Marissa will also be experiencing very limited trunk control. It is very important that the OT uses a gait belt to ensure her safety. A symptom to be aware of is autonomic dysreflexia. It is important to ask the client how they are feeling after they are sat up. It is also good to take the client's vitals just to make sure they are not experiencing any hypertension. In this clip, the OTA supports the client while the OT takes the client's vitals. While the OT is doing the client's vitals, she reminds the fiancé what to look out for in case of an instance of autonomic dysreflexia after returning home. After the occupational therapist ensures that the client is feeling fine, she will prepare the wheelchair for the transfer, making sure that the wheels are locked and that the caster wheels are out of the way so that the client or the therapist doesn't trip on them. The occupational therapy assistant will continue to support the client's trunk. Although the client is early in their rehab journey, it is important to encourage as much movement as possible. It is also important to discourage any non-usage of muscles to discourage atrophy. In this next part of the clip, you will see that Marissa is able to extend her arm to help transfer into the wheelchair. Since Marissa's fiance will be her caretaker after leaving inpatient rehab, we want to involve him in the session as much as possible. As of right now, Marissa is using a manual wheelchair, but after she leaves, she will be using a customized manual wheelchair with power assist. But it's important for the fiancé to know how to remove parts of the wheelchair and how to use it. The occupational therapist makes sure that the client is comfortable using their wheelchair, since this will be their main mode of transportation while in inpatient rehab. Now that transferring and positioning in the wheelchair is complete, we will move to the ADL kitchen to work on kitchen mobility and working with adaptive equipment in the kitchen.
We have some options of things that we can use. So this is a piece of adaptive equipment that I can show you guys. So this can go for this, and this guy is a piece of equipment that you can use and put it on this one. Does it just crank? Yeah, on this side right here, like this.
After reviewing the few pieces of adaptive equipment, the occupational therapist goes over a home modification that the client might want to implement in their own home, which is moving the microwave closer to the edge of the counter, but not to an unsafe area. This will allow the client to be able to still reach the microwave in their wheelchair. After the therapist has reviewed the can opener with the client, they will work together to open a can of soup. This activity will include preparation of the soup in the microwave.
Okay. Good.
In this clip, you see that pouring the soup is difficult for the client due to their limited finger mobility. In this circumstance, we would problem solve with the client to see what options are best for them. The occupational therapist will find what will work best for this client, and that might be having their fiancé pour the soup for them or finding another piece of adaptive equipment like a non-spill bowl. Now the client will start preparing their food in the microwave with some mobility assistance from their caretaker. While the food cooks, the occupational therapist will review some different adaptive equipment for eating.
So you're able to relax your fingers and go like this, and it will bend your fingers like this. Oh my gosh, the 5 minutes in the microwave is going. So we'll put this under, and then if you lift your wrist, you'll be able to grab it like this. And so you can use that for feeding. You can also use the universal cuff, which will go around your hand like this, and will allow you to eat and to brush your teeth.
When the food is ready, the occupational therapist will test the bowl to see what the temperature is like. To prevent any burns or injuries, especially since sensation might be limited, the fiancé will use protective equipment to remove the bowl from the microwave. Introducing a lap cover will also help reduce any risk of burns when the client is ready to remove the bowl from the microwave themselves. For the next part of the intervention, the occupational therapist is going to explain the therapeutic exercise that the client is going to be practicing. They're going to be practicing some wheelchair push-ups to encourage tricep extension. Since this exercise is going to be practiced in a wheelchair with a client that has limited trunk control, make sure that they are positioned properly and that they are safely placed in the wheelchair and comfortable to complete the exercise. The client will then place their hands on the front part of their wheelchair and do a few repetitions of practicing a push-up. This will not be done to fatigue, but will be only done to increase strength to further help tricep extension.
Good. How was that? It was all right. Okay. Hard. Okay.
For the final part of this intervention, we will have the fiancé help us with removing the legs from the wheelchair and moving the client back into place. The OT will then position the client in the bed. The occupational therapist will first move the caster wheels out of the way and make sure that the client is ready to be transferred by locking the wheels and lifting the armrest. After the client has been transferred into the bed, make sure that they are in the middle of the bed to ensure proper positioning while laying supine. Before laying the client down, the occupational therapist will remove the gait belt and continue to stabilize the client's trunk. Here, the occupational therapist cues the client to use their arm to descend into the supine position. She has also moved the wheelchair out of the way so it's not an obstacle for the therapist or is in the way of the client's legs. Now the occupational therapist will position the client supine, ensuring that both arms are supported, both legs are supported, that the heels are floating as to not induce a pressure ulcer, that the sacrum and the hips are flat on the bed, that their shoulders are flat on the bed, and that their head is raised just enough to be comfortable.
Are you comfortable? Call light is right here.
For all spinal cord injury clients, it is important that their position is changed every 20 minutes so as to not induce a pressure ulcer. The occupational therapist will now move Marissa into a prone position. The occupational therapist will make sure to support the head, arms, chest, legs, and feet. It is helpful to position the pillows before rolling onto them so that the client is more comfortable.
Are you comfortable? Okay.
And that is the end of Marissa's intervention session. As she continues through therapy, her activities will be graded up and she will be able to have access to more assistive equipment.